If there were an award for douchebag of the year, one of my nominees might be none other than Alabama's finest representative, Mo Brooks. During an interview with CNN's Jake Tapper on Monday, he claimed that good people don't get pre-existing conditions.
People with pre-existing conditions will be protected. Insurance companies will not be allowed to deny them coverage. But my understanding is, as you just mentioned, this new legislation would allow states to opt out and allow insurance companies to refuse to sell insurance to people with pre-existing conditions as long as there's some setup for them, pools of some sort. Is the president sending a message to Congress to change that provision, or did he not understand what was in the bill?
Well, that's not my understanding of the way the bill has been reframed. My understanding is that it will allow insurance companies to require people who have higher health care costs to contribute more to the insurance pool that helps offset all these costs, thereby reducing the cost to those people who lead good lives, they're healthy, they've done the things to keep their bodies healthy. And right now, those are the people who've done things the right way that are seeing their costs skyrocketing.
Whoa, hold on there for a minute there, bud. Hey, man, these people, they live good lives. They did everything they could to remain healthy. All right, well, hey, great for them. You know what actually helps people do that? Affordable health care. Just saying. And look, if you're going to be incredibly generous, which I guess I am feeling today, you could say that, come on, man, that doesn't mean that you're necessarily a bad person or a terrible person if you aren't one of those people, if you have a pre-existing condition. Well, okay, again, super generous, but you also have to realize there are people who do see it that way, that say that, hey, man, if you do all the right things, well, you're not going to get a pre-existing condition. It's only those people who are lazy or mistreat themselves, or, people who are, eat too much and they're gluttonous and they get the diabetes from being too fat, something like that, right? There are people who out there who believe that. And I shouldn't have to pay more to subsidize your fat lifestyle. Well, hey, again, people do see it that way. I don't agree. And look, there's factual evidence for that too. People who are healthy can get diabetes. You have children that get diabetes. That is a pre-existing condition. For example, I have an anecdote here. My cousin. Now, my cousin, to give you a little information, a little context, this person was a fitness trainer. I had a cousin that's a fitness trainer who was out in California for a while. Guy was in great shape. Obviously, you have to be in good shape to be a fitness trainer. Now, out of nowhere, he developed type 2 diabetes. That illness, that diagnosis, destroyed his marriage and his career. That was through no fault of his own. It's not like he was a bad person, okay? And now on top of that, he's got a pre-existing condition. Well, that sucks. Again, now if without the ACA, he wouldn't be able to get health insurance to take care of himself because, again, he's got that pre-existing condition. Another example. You guys have probably seen the Jimmy Kimmel monologue, right? About his son being born with a heart defect. Well, to go against Mo Brooks, that child didn't even have a chance to lead a good life, to do any of the things right that he says to make sure that you're healthy. You know why? Because he was just born. He's a baby. Obviously, he has no control over that. Okay, the situations like these happen to millions of people. Those are the people that are going to be impacted by Mo Brooks because he's part of the Freedom Caucus. Their change to the ACA to give it to the states to say whether or not they will allow pre-existing conditions to be covered. They will mandate, right? Now, to be fair, Brooke knew he kind of stepped in it earlier, and he said this.
Now, in fairness, a lot of these people with pre-existing conditions, they have those conditions through no fault of their own. And I think our society under those circumstances needs to help. The challenge, though, is that it's a tough balancing act between the higher cost of these mandates, which denies people coverage because they can't afford the health insurance policies anymore on the one hand, and having enough coverage to help those people who are truly in need. And it's a very complicated question, and I'm sure over the years there'll be different permutations of it, both in the past and as we go forward.
Oh, well, yeah, okay, it's a complicated question, but it happens to have a pretty simple answer. You know what that answer is? Medicare for all. That would actually make sure that people would pay less because they would be paying from their taxes and not be paying for health insurance premiums that would, some of that go to profits for CEOs and advertising, etc. And everybody would be covered. You wouldn't have to worry about pre-existing conditions. Everyone's covered. See, we spend more on healthcare already than any country in the world. Because I know, and the reason that I say that is because, of course, you're going to run into people that are like, how are we going to pay for it? How are we going to pay for this healthcare for everybody? We can't afford it. Says people who, of course, want to give more money to the military. No, we actually can afford it. It is more affordable because right now we already spend more than any other country per capita. You understand? We can actually reduce those costs and cover more people by eliminating the insurance companies and their overheads and actually being able to negotiate with doctors and hospitals and pharmaceutical companies for cheaper drugs and cheaper services. You know why? Because when you give the power to the government to negotiate prices, they're going to negotiate lower in order to save money. Just saying. Now, again, Medicare for all on pre-existing conditions, again, there's not even a question. Of course it's going to protect people with pre-existing conditions. It's going to protect everyone. Now, again, when we're talking about price, remember, this is life or death, right? This is healthcare. And not to mention quality of life. Cost should not be a main factor. Most Americans do want the government to guarantee coverage for pre-existing conditions. And according to a recent Morning Consult poll, by the way, 52% of Democrats and 48% of Republicans allow the new ACA provisions or AHCA provisions to allow states to opt out of requiring insurance companies to cover pre-existing conditions. They're against that. They want to save those protections for pre-existing conditions. Again, a majority of Republicans are like, don't let the states be allowed to opt out. Don't. Just don't. And not only that, on Medicare for all, over half of all Americans support, the idea that government-funded health care should be something that the government provides. Now, it provides they want the government to be able to provide health care for everyone, not just the good people. Hey, everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.